Okay, so let's talk about preparing for your Botox or neurotoxin appointment. So you've already booked your appointment and you got the consents emailed to you. So do your due diligence and read through those consents and read through the risks, benefits, and kind of just get a good understanding of what we're doing. So it's really important that you stay away from retinols, vitamin C serums, any kind of thing that is like an anti-aging, chemical-based product that you put on your skin. You want to avoid those just because it's going to make your skin more sensitive. You'll also want to avoid alcohol and blood thinners, as those can just make you bruise more. One thing that you can do to help make your neurotoxin last longer is 50 milligrams of zinc starting 4 days before your appointment. So there's studies that show that if you start taking zinc 4 days before, and if you continue to take zinc, it can actually extend the lifespan of your neurotoxin for about a month. So neurotoxin is expensive and zinc is good for your immune system. It's just a good thing to do. Come in here, you can wear makeup to your appointment because I'm gonna wash your face down with alcohol either way. You'll come into your appointment. The appointment lasts about 15 to 30 minutes, depending on how many questions you have and what areas you want to treat. So you'll come in here and we'll take some pictures, we'll wash your face with alcohol, draw on your face, and we'll come up with a plan, a dosing, and a price that will be sustainable for you. Most neuromodulators last about 3 to 4 months. So it's a good idea to try and plan around getting it 3 or 4 times a year. So let's talk about the different types of neuromodulators or neurotoxins. Everyone calls it Botox, right? I even still refer to it as Botox, but actually I use Botox specifically less than a lot of the other neurotoxins. There's 4 neurotoxins that I carry, and actually in the United States, I think there's 6 or 7 that's FDA approved. So there's Botox, which was the very first one that was approved. They were made by Allergan. They're the most popular, the most well-known, because they've been around the longest. So we do have Botox, we have Dysport as well, Xeomin, and Jeuveau. So they all are a certain class of medication that blocks the nerve signal from the brain to the muscle. And so it's not damaging anything, it's not poisoning the muscle. What it's doing is it's literally just blocking the signal. And that way you won't be able to make those faces that create those deep wrinkles and those creases. So basically this is kind of one of the molecules. The thing that puts that muscle, blocks the nerve signal, is this botulinum A toxin. So the differences between Botox, Xeomin, Jeuveau, Dysport, Daxxify is the peptides and the other binding molecules that they use in the preparation process. So before I get too sciencey, it just basically, there's different types of neurotoxins, neuromodulators, just like there's different types of antibiotics, different types of birth controls, different types of heart medications. They all work in similar ways, but everyone responds differently, right? We all have different metabolisms, different genetics, we're all on different medications. And so my job is to find the right neurotoxin for you and the right dosing for you to get the right duration and to get the look that you're wanting. All of the neurotoxins are about the same in the way that they last duration-wise. So they all last, the nerve signal gets blocked for about 3 to 4 months. Some people get 4, 5, 6 months out of it. Most people at the 3-month mark, their faces are starting to move again. Doing the right dose should get you to that 3-month mark. And then each person has a different response in a different duration. So you never want to come in here before the 3-month mark, because if you get neurotoxin too often, you can actually become a non-responder and build up a tolerance over time. So it's really important to find the right injector, work with them on the right dosing and the right neuromodulator. After your appointment, you're gonna leave here and you might have little red bumps where we did the neurotoxins, and those will subside in about 30 minutes. But you may get bruising. Bruising is always a risk anytime we put a needle into the skin. But it's a low risk. Not always do you get bruised, but that is a risk. Once you leave here, you want to avoid the gym for 24 hours. You want to avoid saunas. You want to avoid getting sweaty, anything like that. You just don't want to sweat out the neurotoxin. You want to let it sit in the muscle until it takes full effect. You also don't want to go get a facial. You don't want to go to the chiropractor and like lay it on your face. Don't take a nap on your face. You also don't want to wear a hat or a headband. So I always just say, just leave your face alone and just give it about 24 hours of rest. It takes about 2 to 3 days to kick in, and you'll be fully effective around the 7 to 10 day mark. If you need a follow-up, you will come in at the 10-day mark, and that's when we'll do just a little bit of extra to get it completely perfect. Not always do you need a touch-up, but if it's your first appointment with me, I try to be conservative because we can always put more in, but we can't ever take it out. And then you'll make your next appointment for about 3.5 to 4 months. And then the idea is that you'll kind of want to do that on that same schedule from here on out to keep that face nice and smooth and keep those wrinkles from getting deep. Where all can you get neurotoxins? So this is actually really cool. We're finding more and more uses for neuromodulators and where we can use them. So of course the most popular is the glabella, the frontalis, the crow's feet. We can also do a lip flip, and we can also do gummy smile. So if you feel like you show too much gums when you smile or your lip rolls under too hard when you smile, we can treat that area. A newer or more popular area is the lower face. So we can treat the DAOs, which are what causes the jowling as we age, and the mentalis. So this kind of creates like an orange peel chin, and then it will pull up as we age and won't create the frown face. So we can treat that. We can also treat the platysmal bands, and that also helps prevent the pull down of your lower face. And you can treat this area, which is called the Nefertiti facelift, and that will help keep your jawline nice and tight. Another one that we do here a lot, because I work in a dental office, is masseters. So if you're having any TMJ issues, if you wake up with sore teeth, if you're getting a lot of clenching, a lot of grinding, if you're getting broken teeth, getting headaches here, we can also treat that area, and it not only will help protect your teeth, but it will help with headaches and TMJ pain. We can also inject here in the different areas of the head for migraines. Another popular area to do is underneath the arms or the hands, and that helps with excessive sweating. One other really cool area is rosacea. So if you're somebody that gets a lot of rosacea on your cheeks, you get really red, doing a hyperdiluted neurotoxin can help with that too. If you do get chronic migraines, or if you're wanting to get the neurotoxin in the back of your neck and your trapezius or all over your head, it's a good idea to go to a neurologist, because you can actually get your insurance to pay for it if you go start seeing them, and they're just a little bit more experienced in that area.